Hello friends, I am Dr. Vijay Prakash and today I will be telling you about metal tryin of a cast partial denture framework. Now before trying the cast partial denture framework in the patient's mouth, you have to check it on the master cast. So first thing is you should try and place it on the master cast. That is, make sure that the fit on the master cast is good, there is no interference. And first thing which you are going to do is you try to insert, whenever you are trying to insert the processes, make sure that you are not forcing the partial denture onto the master cast. The processes should be examined under a good light. See the impression surface of the processes. You may notice some, there could be some metal blebs or metal artifacts, as you can see, which I have marked with red color. So these metal blebs should be trimmed with the appropriate abrasive stone. Whenever you will be inserting the cast partial framework on the master cast or in the patient's mouth, these metal blebs are going to interfere and will not allow a proper seating. So these have to be first trimmed and removed. The framework should be placed in the planned path of insertion. Better it is if you can place the master cast on the surveyor at the particular tilt and then insert the processes in that particular path of insertion. That will be better. And also the framework should not have an active, it should not forcefully go into, as I mentioned, it should not forcefully go into the seat into the master cast, because then it will be active. The fit should always be passive and the retentive class should be engaging into the retentive undercuts. So once you are sure and the framework is completely sitting on the master cast, then they are ready that they can be tried in the patient's mouth. Before sitting in the patient's mouth, again the framework should be checked under proper light and see if there is any kind of interference or any kind of problem there on the cast framework that can be taken care of before inserting in the patient's mouth, or any roughness or sharp edge is there that can be trimmed with the proper abrasive stone. Now once it is done, all this is done, then the framework is with a very gentle hands, it is placed onto the teeth in the patient's mouth. If any interference is there, you can use a disclosing paste, like a white paste or a wax you can use, and those interferences are removed using an abrasive, and then the partial denture is allowed to be seated into the patient's mouth. Check that it has completely gone in and you have followed that particular path of insertion which was planned for this type of processes. Another thing is, excessive force should never be used when you are trying the framework in the patient's mouth. The framework in the areas of occlusal rest and clasp assembly should be checked thoroughly for any interference in occlusion, and this should be checked in both the eccentric and the centric occlusion. So any interference that can be checked with the help of articulating paper. So you can use an articulating paper between the teeth once you have seated the framework and check if there is interference. Ask the patient to make movements, that is the protrusive movement and lateral movements. Check whether any interference is there on the rest or in the clasp region. So that should be trimmed before removing the processes. And finally, it should be ensured that the framework is having a passive seating, and it should not be applying too much of force, or it should not be applying any type of force on the abutment teeth and on the residual ridges. So this is all about the metal tryin. Thank you for watching the video.